Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
So what is chiropractic? What is animal chiropractic? Animal chiropractic is nothing more than using our hands to find, identify, remove vertebral subluxations in the animal's spinal cord. Could be a chicken, could be a dog, could be a horse, cow, goat, cat. We've adjusted them all, even some exotic animals. But that's the goal, to remove these vertebral subluxations. What's that do? One, it enables balance between the autonomic nervous system, the parasympathetic, and the sympathetic nervous system. Parasympathetic and sympathetic nervous systems are opposites, and they have to be in balance. One is fight and flight, one is relaxation and digestion and bodily functions, healing. So it's very difficult for the body to heal, very difficult for the body to overcome things if it is in sympathetic overload. Fight and flight, okay? Just can't happen because the body has got an increased heart rate. It has increased adrenaline. It has all kinds of activities that go on. And if that stress stays around for too long a time, you know what? We get things like diabetes and Cushing's and Addison's, all these diseases that we call them, chronic diseases in animals, in our animals, that are really just because stress didn't leave. You know, if I startle you, boom, all right, blood sugar goes up. Should go down within a couple minutes. But you know what? If you're stressed, if your body is in sympathetic overload, that sugar level never goes down. It stays high. You know, what are we going to do with that high body? That high sugar level, it becomes diabetes, you know, which is definitely a problem. You know, we have all kinds of animals that have insulin resistant diabetes. In horses, we see problems with, you know, animals that can't respond appropriately. Their adrenal glands are shot. You know, we have Cushing's and stress diseases that we see in our animals, and all it is because their sympathetic overload is just too high. I saw a puppy today, 8-month-old puppy, you know, and all we did was adjust its atlas because we did a leg length check. We had 2 inches difference in this puppy in leg length. Adjusted his atlas, they got even, and the owner was like, "Oh my God, he's so much more relaxed. Look, he's just sitting here quietly. He never does that." So she went to leave, and the dog walked very, very mannerly at the end of the leash. And she was like, "He's always pulling on the leash. He's always doing this." Well, his stress levels are down. He can pay attention to what he's supposed to be doing. He can make better choices now. His nervous system is in balance. He's able to adapt to his surroundings. And yes, he's able to behave like he's been expected, like he's been taught. He can now become the pet that those owners are looking for. So chiropractic adjustment, allow the body to heal from the inside out, above, down, inside out. Allow the body to respond appropriately to and adapt to changes in the environment, not immediately turn in to a stressed individual, a fight and flight. Oh my God, which way out? Where am I going to go? All right. Allows the body to relax and say, you know what? Yeah, that thunder is not such a bad thing. Not going to get me. You know, I'm here. I'm comfortable. I'm okay. Above, down, inside out. Adaptation. That's what animal chiropractic is about. Have a great day. We'll talk to you later.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Helping others experience an abundant life with the gift, art, and blessing that is animal chiropractic is our sole mission at ACES. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to providing the highest level of chiropractic possible. And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome, right? Yeah, we all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro Website Pro, Tony Seymour. He's a professional web designer, and his team at the Chiro Website Pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the #1 hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com and make sure you ask them about the special ACES discount and let them know Dr. O sent you. You'll be glad. You did.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
I love that idea. I've just started using chiropractic myself, and I love the idea of animal chiropractor. You diagnose my dog just by looking at him.
Yeah. And chiropractic is basic. And even in fact, most people that have taken a high school science class know why chiropractic works. Because we learned in high school science, biology, right, that the nervous system controls everything. Okay? Now, so when we have the brain that talks to the rest of the body, and then the rest of the body talks to the brain, that's where we determine what to do. But if happens, right?
Sure.
Like you're sitting over there going, what's he saying? What's he saying?
Right. Okay.
We had a subluxation between us. So we removed the subluxation. Okay. And now you can hear what I'm saying. I can hear what you're saying. And we can understand what's going on. And we can plan accordingly.
And that's how chiropractic works.
That's all chiropractic does. Chiropractic's goal is not to cure anything, not to fix anything. Our goal is to remove nervous system interference to allow the body's innate ability to heal itself.
Okay.
Which, as a fitness instructor, you know, you understand you don't build muscle. Your body does.
Love that.
You know, you can give me a workout and I can be like, yep, I'm doing it. Yep, I'm doing it. Yep, okay. Yep. Oh, that's what hurts. And then you know, 3 months from now we look and you're like, Dr. O, you're not making any muscle. How come? Because my innate said, I'm going to let Mike do all the work for both of us. And it doesn't work that way. My innate has to do the work. When I give my innate the tools, which might be exercise, okay, which might be rest, it definitely includes nutrition.
Chiropractic.
And keep the nervous system interference out of there, then we can do something. Yep.
Yeah. Okay, I love that. So tell me a little bit about chiropractic and muscle recovery, fitness recovery.
Okay.
Break it down for people that don't know it.
All right. So there's two ways that we can, and I think we did this when I was at your place. And so do you got a piece of string handy?
I have a cable.
Okay. All right. Can you, so wrap it around one forearm. Okay. All right. Now wrap it around, try to keep that spot.
Okay.
And then wrap it around the other forearm.
A little tighter.
A little tighter. Huh?
Right.
How come? In our case, you're right hand dominant. Correct?
Yep.
So you use that arm more than you do the other one. All right.
Makes sense.
So your animal, though, your dog, your horse, cat, whatever, uses every muscle, every ligament, every tendon, every joint, and every bone in their body every time they take a step. They're not naturally right-hand dominant, left-hand dominant like we are, okay? And they don't do very many one-handed, one-legged things. So they use their whole body to move, all right?
Okay, right.
So if we look at their legs, so if you were a dog, if I looked at your dog and one leg is tighter than the other leg, one leg is a little bigger than the other, we know it's not use. So that means there's only one thing that it can be: lack of innervation. And lack of innervation will cause noticeable muscle loss in about 7 days. So if I took your arm and put it in a sling or a cast and didn't let you take it out, it would take 7 weeks before I could look at it and go, whoa, Mike, you're losing some, definitely got some issues there. If I cut the nerve to that muscle, it takes 7 days. So when we're trying to rehab from an injury, from build some muscle, if I'm lifting weights, but I have nervous interference on one side, even though I'm lifting evenly,
Not building evenly.
I'm not but building evenly unless my nervous system is free of interference.
Okay. So now who's going to be really prone to this? What kind of athletes are prone to this kind of needing this recovery?
Anyone with a spine.
Okay. So break a few things down for me. Let's talk about some traditional athletes, how they may come across something just real minuscule that can grow into something big if they don't get it taken care of. But let's just say like a high school soccer player. Okay. So what?
All right. So he sits at the desk all day.
Yeah. Okay. Let's start there. I was going to start on the field. Okay.
Well, he sits at the desk all day.
Okay. He does. Yeah.
And then he's a little late to practice because, he forgot, dropped a pen, had to flirt with the girl on the way to, who knows, but just something happened. He's a little late to practice. So instead of doing 20 minutes of warm up, he does 10.
Okay.
And now he goes and plays soccer, has a normal game, but is his body ready to do that? Because he didn't do it. So now maybe in that he might tweak a muscle. All right. So then he's going to favor it. So when he favors it, now we're going to put a kink in our spine.
Okay, got it. So what I'm hearing from you right now is I'm going to stop you. Forgive me.
Yep.
We're not talking about a spinal injury needing to go to the chiropractor. Any kind of little muscle thing causes you to walk with a limp, get off your step, get off your normal gait.
Yep.
And next thing you know, you've created a what do you call it?
It's called a subluxation, which is less than a luxation. So if these two bones were side by side,
yep.
Okay, that's a luxation.
Right.
We know that. Boom, dislocation, luxation. All right. There's a subluxation. You say, look at it this way, there's a subluxation. Just a little tweak, but it's enough. We know that the weight of a feather on a nerve decreases nerve transmission by 50%. So imagine, here's what 50 would, if had.
Okay. Yeah, for sure. I get that. That's cool. That's good. Those are, your ability to use examples is great. I love that. And so you're talking about the body, the athlete's body is going to obviously be a lot heavier than a feather.
Right. Yeah. And so it is. And then, in the soccer player, the number one time is, he heads the ball.
Okay.
Boom, boom, and that's going to tweak that neck every time. And I like to say, how many times have you been to the grocery store in the last year? Too numerous to count, right?
Yeah.
All right. So you're coming out of the grocery store, and how many times when you step off that curb, you got 2 bags of groceries, how many times did you stumble just a little bit?
Okay. Sure.
Maybe 20, right? But how many times did you go, oh, fuck, I hope nobody saw that?
Yeah, sure. A couple times.
Couple times. Those 2 are the ones we worry about. Okay.
Yep. Okay.
And that's probably the one that did it. Yeah. Anytime you step off that curb wrong, you can tweak your nervous system. Okay. Maybe not. But boy, those times where you just, really flat out, that probably really did it. Okay. Really did it. And chiropractic is powerful.
It is. I've been using it myself.
Most powerful tool we know.
That's really nice.
We have paralyzed dogs that walk all the time after they come for chiropractic care. We have chiropractic horses. Our common athlete increases their performance by 10 to 20, 25%.
I totally believe that. Hey, so tell me about this. What do they say about people sleeping wrong? Can you just sleep and wake up and need to go to the chiropractor?
Well, you can, yeah. There's so many different things that you can.
Is there a proper way you should sleep, Doc?
I sleep on my stomach. My wife sleeps on her back. I don't know.
Okay.
If I sleep on my stomach wrong, then I wake up stiff. If I sleep on my back, I wake up stiff. So I think you need to do what's best for you. And that's a lot of times what, so I am not a morning person, never have been a morning person. Okay. And if I try the, get up at 4 o'clock thing and it doesn't work for me, does not work for me at all. Now, I get up without an alarm at about 7 o'clock every morning, no matter what time I go to bed. And that works great for me. Okay. So how stressful is it going to be for me to set an alarm for 4:30, fight the alarm clock for, 3 hours? That's not going to be good for me. There's 3 things that cause these little tweaks in your back. One's trauma.
Okay.
That's pretty self-explanatory. Number 2 is toxins. Toxins in the environment, toxins in the food. Sometimes,
Wow.
and the thing about it is that food that used to be healthy for us may not be healthy now. And it's not because we've evolved. It's because it's not grown the same way it was.
Go a little further on that. You talking vegetables?
Yeah, like vegetables even. And, grandma's tomatoes were fertilized with cow manure, right? Or chicken poop, and that stuff was fed, it grazed, and there wasn't no Roundup in their environment, none of that stuff. Well, now, now we know that ivermectin, okay, which is a wormer, it works for COVID, all right, COVID treatment, because it kills almost everything, including dung beetles and soil bacteria and all kinds of stuff like that. So if I put ivermectin in my cattle to deworm them, what's going to be in their poop?
Ivermectin.
Ivermectin. So then I put that on the garden that your tomatoes come from.
Oh boy.
Now what's in your tomatoes?
Yeah. Wow. Next thing you know, huh?
Yep. Or, I spray a little Roundup and my cows eat that in their hay, and then, they poop, and now that goes on and now you have Roundup ready tomatoes and, all kinds of stuff, right? So
Wow.
in 1982, there were 7,500 known phytoestrogens in the environment. Those are fake estrogen compounds. They mimic estrogen, okay? All right, there are over 75,000 known phytoestrogens right now.
Break that down a little further. I never heard of that before. Don't know what that means.
So a phytoestrogen, if it kills something, smells something, has a color, there's a pretty good chance it's a phytoestrogen. Estrogen, we know what estrogen is. It's the female hormone, right?
Yes.
All right. Males have a little estrogen. We have testosterone, but we also have estrogen. We have estrogen receptors. These phytoestrogens come in there. They sit on testosterone receptors. They sit on phytoestrogen. I mean, I'm going to be kind of blunt here. So if you have your children with you, this part won't be child friendly, this next, but how many man boobs did there used to be in the world?
Yeah, no kidding. I never seen them before till now.
Why? Well, it's not necessarily, it's obesity, but it's estrogen. All these guys are living in a sea of estrogen. That's why they develop boobs. Otherwise you just get fat.
Sure.
You don't get boobs and,
That's weird.
Yeah. But with the female hormone, men develop boobs. It's all over. It's everywhere. It's in our food, toxins. So why do we, And then the third thing that causes subluxations is stress.
I don't have any of that.
I
work with the best clients on earth. They show up on time. They're incredible.
Right. And they all pay their bill like immediately.
Tell me, first of the month, auto withdrawal. You guys are awesome.
Yeah, but you know.
So non-traumatic stress.
Non-traumatic stress. Just COVID. Are they going to make you get a vaccine? Are you going to have to wear a mask? You know.
Oh, that kind of stress.
Yeah, that kind of stress. Any kind of stress. You know, the same stuff that builds an ulcer. Makes your blood pressure get high. That stuff can cause vertebral subluxation.
Now check this out. That person gets stressed out. Where does he need to be adjusted?
Well, probably the atlas. Everything goes through the atlas, but it could be anywhere in the body. You know, anywhere. The mid back is bad. You know, sitting will cause more problems with your pelvis. But we're doing some experiments with my chiropractor, and he's only adjusting my atlas right now. And then I get up and walk around, and then I go about 5 minutes later, I lay back down, and 90% of the stuff that he would have adjusted is gone. It took care of itself. But just by keeping the first cervical vertebra moving.
Now what's the common name for the atlas again?
It's the first cervical vertebra. It's the first vertebra right below your skull. Yep. Every nerve goes through there. Sympathetic nervous system sits right there. Your brain stem sits right there. All kinds of big, important stuff sits right there.
Yeah, it sounds like I shouldn't be touching that part of myself. With these stone hands. Okay.
You should know what you're doing, yeah.
Okay, so check this out. Here we go. We got some people that are going to be saying, okay, doc, but I don't have no chiropractor. Who do I know that's a chiropractor? What do I do? What about me? How do I find my chiropractor? What do I do?
It's pretty easy. You know, you go to the yellow pages, find one that has good reviews. You can call up. What I recommend is call up and say, hey, are you a pain chiropractor or do you believe in prevention? Because you want somebody that does prevention. You know, a prevention chiropractor can get you out of pain, but a pain chiropractor really isn't worried about helping you prevent future episodes.
Okay. He's like I'm an emergency. I need it right now kind of guy.
Yep. Yeah. And he'll help you and you'll be good and you get everything going. He'll probably see you, he might see you 9 times in 3 or 4 weeks and then say, okay, see you next time. And then you're on your own until you happen again. Here's the thing. 0.05% of your nervous system deals with pain.
Okay.
So that means 99.95% of your nervous system deals with the other stuff in your life. For instance, here's one thing. Okay, so I want everybody to consciously think about their big toe on their right foot. Okay, you really haven't thought about that the whole time we've been sitting here, have you? All right, so the 14th cell over, okay, can you picture that 14th cell over from the outside of your big toe?
Sure.
Just took a shit.
Damn it.
Okay, now that's got to come through your foot, up your leg, okay, up into your liver, get filtered out so that next time you decide you need to go to the bathroom, you can get rid of that, okay?
Wow.
All right. Whoops, there's the 13th one just did it now. So now bring that up. Oh, the 11th one went. Oh, the one on your right toe went. Oh, my gosh.
A lot of other stuff besides pain, huh?
Yeah. Aren't you glad that we don't have to think about any of that stuff? All right. So, the average human takes what? How many breaths per minute? You should know that. How many times you breathe a minute?
I don't really know. I mean, I try to test myself, but how many times? 10?
Let's say 10 to 20. Let's just say 20.
Okay, so they said 10. Okay, 20. Yeah, for most people.
20. All right.
Yeah.
So we've been sitting here now for about 30 minutes. So 30 times 20, that's 600 breaths.
That's a lot.
How many of them did you have to say?
Yeah.
Then breathe out.
Here we go. Here we go, lungs.
Coming in,
No.
going out.
You guys ready? Feeling good. Yeah, it
All
wasn't
right.
happening.
No, we don't have to do that. Can you imagine one of your morning workouts?
Oh, man.
If we had to tell every cell in our body, come on, heart, keep going, baby. I mean,
Keep pumping.
When we're working out, you're going like, come on, Dr. O, you can do it. One more. You got it in you. One more. But just think, if you had to cheer for my lungs, my heart,
Wow.
the 14th cell in my big toe,
Sure.
you know, that's what we call white noise.
Yeah, for sure.
Your brain just takes care of it. Takes care of it. Sometimes it does it easier, you know, than others. When you have a headache, do you notice things?
Yeah.
You notice that the 14th cell on your big toe maybe hurts a little bit.
Yeah.
Maybe it's a little constipated today. I mean, you know, who knows? But when
Who
you don't
knows?
have a headache, you don't notice that stuff, right? It just happens. So, and one of the best ways to get rid of that pain and deal with it when you're having it is go to the chiropractor. But then that chiropractor also helps when you're not having pain, helps all that stuff go on in the background without any problem.
On average, Doc, how often you think a typical athlete works out 3 or 4 times a week, maybe play some recreational sports? How often does that person need to get into the chiro?
So for a start, once a month for most people would be great. If you just went once a month, that'd be fantastic. Then, you know, you're going to have times where, here's the thing is that we go weekly.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Welcome to Dr. O's opus of animal chiropractic. Chiropractic consists of 3 parts: the art, the science, and the philosophy. This last segment of today's podcast is loaded with the philosophy and principles of animal chiropractic.
Animal chiropractic, is there research or not? There's a lot of research and there's a lot of anecdotal evidence. And which one do you prefer? Anecdotal evidence, well, it's just stories, you know, blah, blah, blah. How do we know? Research. Do you want your loved ones, your pets, your horses to be involved in a double-blind research study? You know, everybody says, well, I want the double-blind research study, but nobody wants to be involved in it. Because let's face it, if you're involved in a double-blind research study, there's a 50-50 chance that you're getting nothing. You're getting a placebo effect. And experimental protocols. You know, who sets up the experimental protocols? Some of them, like there was a study done with vitamin C. It's recorded in Dr. Schoen's book on medicine, on alternative and integrative therapies, veterinary medicine, where, you know, these cats were on large volumes of vitamin C, 8 grams of vitamin C a day, and all of them cleared, became feline leukemia negative. They're all positive going in. They all got negative, but most of them developed some severe kidney problems because of high doses of vitamin C. Actually, they all developed diarrhea before they became negative, but the experimental protocol said they had to stay in and on that high dose of vitamin C until they tested negative at the beginning of every month. So a lot of those cats had rip-roaring diarrhea, ended up with dehydration, and that's what led to the kidney failure, not the high doses of vitamin C. So animal chiropractic, it's been around since 1895, hasn't changed. Why hasn't it changed? Because it works. Don't need to it. You know, and prove it works. Prove it doesn't work. You know, animal chiropractic works. Anecdotal, I've got a lot of people that it works on. And here's the thing. If you do adjustment, drugs, and surgery in that order, if the adjustment doesn't work, no harm, no foul. Now you go get some drugs. Oh, there's a chance you might have a side effect there. Surgery doesn't work. Guess what? You can't undo the surgery. So, animal chiropractic, keep your animals adjusted, above, down, inside out. You know, if you've got an injury, if you're doing some activity level, it takes the body time to heal because it takes the body time to get sick. When did the first injury occur? Working on a dog right now that we thought the first injury occurred back in November, but actually looking at some pictures, the first injury probably occurred about 4 years ago. So how long is it going to take for that dog to get better? All right. Above, down, inside out. Keep your dogs, keep your bodies adjusted. Have a great day.
Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.